Hi Nyasha.
Hello.
So we're recording today to give viewers a bit of a background on you, who you are, what it is you do, and how you do it. So, who are you?
I'm Nyasha. I am Zimbabwe. So I was born in Zimbabwe. That's where I spent my formative years, like my teenage years. And then I came over at 18. And so my adult life has been spent in the UK. Yeah.
In Yorkshire, from Leeds, or?
I've been around, actually. I've been around. I've lived in Essex. I've lived in London. And then I've lived in Yorkshire now for about 6 years. Yeah. So I've travelled a bit. I've seen the country a bit.
You have? That
Yeah.
sounds good. Yeah. I have a similar background, Africa originally, but not as long. 13 when I came to the UK.
Yeah.
But predominantly North East. So Essex, London,
Yeah.
and 6 years in Yorkshire.
Yes. I may be classified as a Yorkshire lass now. Yeah.
Not a bad thing.
No, well, yeah, not a bad thing. I don't mind it. Yeah, I like Leeds now. Yeah.
And you work from Yorkshire, from Leeds, where?
Yes. So I've got 2 jobs running at the minute.
Right.
Right. So I work as a psychiatric nurse. I'm also a psychotherapist in private practice. So I've got both jobs running at the moment. I love both equally because I do think they complement one another. So yeah. So I initially trained as a nurse and then went on to do my postgrad and trained as a psychotherapist.
So when did you train as a nurse?
I trained in London at Buckinghamshire Children's University. Yeah, that's where I did my nurse training. And after that, I moved up north and then I started working in New York. That was my first job as a nurse, as a qualified psychiatric nurse.
For NHS? Or?
No, I worked for an organisation called The Retreat, which was a therapeutic community. When I started working there, I never knew what I was getting myself into. It was like, yeah, it was my first job. I was open to anything. So I went to The Retreat, and a therapeutic community is basically an establishment for ladies with a diagnosed borderline personality disorder. But the idea is the model is very therapeutic, it's very community based. So though we've got staff there, the idea is that the patients support one another and the staff just facilitates their therapy and and supporting the women to be a community basically. So say if someone needed to go to hospital, the nurses didn't go, but they would take one another, they'll have meetings, emergency meetings. So that was that was a very different experience from what I've been used to.
Yeah, it sounds really forward thinking and humanistic.
Yeah. And I think, to be honest, I think that's what drove the whole idea for me about talking therapies, about getting into therapy. Because it was very much DBT based, very therapeutic based. So it was this.
And DBT for the viewers
is dialectical behavioural therapy, which is the main mode of treatment for people with a diagnosis of borderline personality disorder.
Which is one of the hardest diagnoses to work with.
Yes. Very challenging, very difficult, but very rewarding. Equally very, very, very rewarding. Yeah. So no, I really enjoyed my first job. That just got me thinking about the whole idea that we use medication to treat certain illnesses, certain diagnoses, and how I think my experience at the retreat was that actually what people needed was just someone to talk to and to gain an understanding about what's driving this behaviour, what gets you going, why are you doing the things that you do, which was an experience that I never really had. Excuse me, during my training, a lot of the placements I had was very medically based. Yes. So a lot of medication, a lot of injection, a lot of restraint, physical restraint. until we went to the retreat. So yeah, I had a very different experience.
Two big polarities there, isn't it?
Very much so.
Strong medical model and then community-based, humanistic model.
Yeah, it was pretty much a shock to the system, to be honest. As a newly qualified nurse, I had never experienced it. I'm like, what do we do? And they're like, let's talk. I'm like, is that it? Yeah, so, I struggled. But in my struggle came my learning as well. Yeah, I learned a lot from that experience.
So individual work and group work combined, was it? Or?
Yeah, so the model basically, what they believe is from the moment you wake up, that's where the model starts. So you had breakfast together, the staff and the patients, and it was very much structured in a way that you had like groups running from 9 to 5. And it was very much group work and then individual work, and then they also had group psychotherapy, which was a closed group, and that ran for 6 months. And then every Friday they'll have like an emergency meeting or a review of the week basically. And this was really good for the staff and for the patients because everyone would kind of sit around a room and review their week basically. How your week has been, what your highs were, what your lows were, what you could do differently. You could set goals, you could get feedback from the staff and your peers. So it was, very, very therapeutic, very therapy-based, as it were. And I felt drawn to that. That pulled something in me that kind of thought, right, I need to learn a bit more about this because this makes a lot of sense. So yeah.
Sounds very horizontal and relational.
Yeah, very much so, very much so. And I guess the consultant as well, because I think what you find in a lot of, in the medical model, there's a lot of hierarchy, and the consultant is someone you can never speak to, whereas this was very different. We also used to have group supervision for the staff, and we had psychoanalysts come in and would kind of name the process of what's going on in the room, which was an experience that I'd never had. So I really enjoyed that. I definitely enjoyed my first job. It's great.
Yeah. And then leading on to postgrad training, psychotherapy. Where did you go for that?
Yeah, so I went to an institution called Scarborough Psychotherapy Training Institute. It was in Scarborough. I did that alongside my working life. So I worked full time, and then every sort of 4 weeks I would go for the weekend in Scarborough to train as a psychotherapist. And I did that for 4 years. And in that 4 years, I didn't know this at the start, but we had to be in personal therapy. And that was, something that I couldn't imagine. I'm like, why do I need to be in personal therapy for? How does that make sense? Why can't I just go to school, learn this, and just become a psychotherapist? That was a prerequisite for the course. So I thought, right, you know what, I'll just go and get on with it. And you know what, it's only personal therapy. But in my head, I had no reason to be in personal therapy. It was a prerequisite. And that's the first thing I told my therapist. I said, listen, I'm here because I need to be here.
I'm resistant.
Yes. I didn't know those words at that point.
Do your best.
Yes, I didn't know any of those words about resistance or anything like that. But I was just like, listen, I'll do what I need to do. But I've got no issues. I've got no trauma. I've had a perfect childhood. I've got no problems. So I'll come in every week and we'll just do what we need to do. So that was, and he just smiled like you're doing now.
Set him that way.
And then 5 years later, it's the best thing I ever did. Personal therapy was hard, don't get me wrong.
Personal therapy. As a therapist, I understand is that you've had to undertake your own personal therapy over the years through your training. And 4 years training postgrad, wasn't it?
Yeah.
So, how was that?
Wow. personal therapy. So obviously,
Shock horror.
yeah. So I went on to the course, and I thought it's going to be very much academic, which I was fine with. I was good to go with that. And then I turned up, and on the first weekend day, the tutor says, right, you guys need to organise your personal therapy. I'm like, you what? I was like, yeah, you need to be in personal therapy for the duration of the course. And I was thinking, does this woman know it's 4 years? What the hell do I need to be in personal therapy? Weekly, by the way, yeah, was the minimum requirement. I'm like, what do you do every week for an hour talking to someone about what? So anyway, she insisted that we be in personal therapy, and that was a prerequisite for the course. So I went about looking for a therapist. I don't know what to look for. I just needed someone that would just sit there in my head, would just sit there and have this conversation with me, yeah? And that would tick the academic box, and that would get me through the 4 years. That's what I thought. So I went online, and I went on the psychotherapist website, UKCP, which is the governing body. And I looked for therapists within my area. So my initial thought was, right, I need to get a black woman. That was my initial thought. But guess what? There are no black female therapists in Leeds that I could get. So I thought, okay, I'm screwed. So then I thought, right, let me get a black male therapist. I couldn't find anyone either. I thought, okay.
What was behind that?
I think for me, the reason why I felt I needed a black therapist, I wanted someone that would relate to me,
Somebody would get you in your
that
life.
can understand me. And I think I didn't want to feel missed. I didn't want to feel like I had to explain myself, because that's been a bit of my history, a script in my life where I have to kind of constantly explain myself, and I didn't want that. So I thought, for some reason, if you're black, I feel like you'll get me, you understand me. So I was a bit disappointed, obviously, that I couldn't get this black psychotherapist that I was looking for. So then I just thought, you know what, just go and see a couple of therapists, see how you feel about it. So the first therapist I saw was a psychoanalyst. I didn't really know what psychoanalysis was about, but I went. But I remember sitting in this therapy room with this man, and he just sat there. And
Blank screen.
yeah, and I thought, no, you're just gonna sit there? I never said it out loud, but I just thought, come on man, this is my first day, you know, I didn't feel welcome. It was not warm, the experience of the room, and I thought, no, this doesn't make sense. And the reason why I'd gone to him was because his initial assessment consultation was free, and most other people were charging. But then I had pre-booked for someone else later on that day. And I think, to be honest with you, I think he only asked me like 3 questions in the whole hour I was there, and there was a lot of silence. And I struggled with silence anyway to begin with, so that felt so uncomfortable. And I remember leaving that room and thinking, oh, this is not for me. This will not work. If this is what he expects me to do, just come and just tell him my whole life history, he's got to be kidding. So I never went back again, and I kind of said to him, no, I don't think it's going to work. And then I went later on to the second therapist, who was white, middle-aged, middle class, really nice house. I remember remember thinking, oh gosh, what do you know about black people? This was before I even kind of started speaking to this man. And within 5 minutes, I felt so relaxed. I felt he had seen me. I felt heard. I felt there was a relationship. I felt he was interested in getting to know me. I didn't feel he was making any assumptions. And yeah, and that hour just went by so quick. It was easy, let's put it that way. It was effortless. Yeah, and for the first time in a long time, I kind of really felt heard. And that sealed the deal for me. I just thought, that's it. I'm going with you. And 5 years later, I kept the same therapist. I saw him weekly. And boy, was I wrong. All my assumptions about, I need to see a black psychotherapist, I need someone who kind of looks like me for me to be seen, for me to be heard. And in all my life, and in all my experiences I've had, I've never felt so heard, felt so seen. Yeah. So that was really quick, fast learning for me within my first experience of therapy. So I guess the moral of the story that it's not so much what the person looks like, it's not so much about the colour of their skin. I think it's more about what they bring to the table. Are they willing to see you? Have they got the capability of seeing you? Are they listening to your story? Are they not making assumptions? Because I think sometimes people make a lot of assumptions because maybe I've seen someone like you before. Maybe I've heard about someone like you before. And that takes away from just being present and actually seeing the person as they are in that moment. And that's what I experienced. Yeah. And he made such a difference in my life. If you had told me beforehand that this man would be my therapist, I would have said no. Yeah, if you had pointed him out, I'd be like, there's no way. It felt, on paper, like we came from two very different worlds. Yeah. And that our worlds would never meet. But boy, did they meet. And I think when you work with someone for that long, you get to know them as a person as well, and some of their history and some of their story, and realize that actually we kind of all have quite similar stories. And I think there is something about what draws you to a particular therapist. I think unconsciously there is something about your stories merging at some point, something that they know, but both of you don't know it at the time, but there's something I think that draws you to someone about your histories or your stories or your scripts. And yeah, and I really felt that with him. So
it sounds like a real connectedness in the field.
Yeah.
You know, that even though you came from completely different backgrounds, you know, and it was natural for you to project, you know, and for you to transfer onto him.
Yeah.
His meeting you and giving you confirmation and you know, validation, really seeing you, allowed the two of you to dance almost. You know? The two of you to start out with a really slow dance to start with, sounds like, and then you know, you could really cha cha cha.
Yeah, very much so, very much so.
So why did you become a psychotherapist?
Wow, good question, good question. I think it came about from my nurse training, which was my initial training, working with women with a diagnosis of borderline personality disorder, and working within a therapeutic community. And the work there was really about understanding these women. It wasn't about the medical model per se. It was more about, let's get to know the person in front of us. Their individual, not the community, but the individual. Let's get to know their history. let's really think about why they're behaving the way that they're behaving. What does their history tell us? How has their history set them up, per se, to become the person that we see now? The person that's cutting, the person that's quite suicidal, the person that's really emotional. And it kind of got me to think about myself. And I'm like, okay, so why do I do the things that I do? Why am I the woman I am today? Why do I date the people that I date? And then I thought, okay, I best go study about this. Let me go and understand why we behave the way we behave. So I decided to go into psychotherapy to learn more about what drives us, how perhaps our environment sets us up for a particular sort of personality, for a particular sort of experience, how our emotions run, yeah, and how sometimes people go through similar experiences, but how we respond to those experiences is very different. And a lot of that comes from our history. So I wanted to understand that. So I thought, best way is to go into psychotherapy. And the great thing about training as a psychotherapist is you go into personal therapy. So you learn about you first. And that was really good, because the more I understood about me and why I do what I do, and why sometimes I feel what I feel, I was able to have that empathy for the person that sat before me when I become the therapist and they become the client. Because I pretty much kind of sat in their seat almost, whereas I was on the receiving end, as it were, and I was the client. So I kind of have an experience of how it may feel. Granted, my experience may be different, but I have an understanding of perhaps what they're going through, and I think that sets you up to be a good therapist, because you're not just making assumptions, and you're not just a person that's never really experienced what you're kind of encouraging or facilitating your clients to go through. Yeah, and I think I had a natural knack, as it were, because a lot of my friends would come to me and say to me, oh, tell me this, some story about what's happened in their lives, and I'll be like, I could listen and think about, okay, but why have you responded that way? And this was before my training, and just say something to them about, okay, maybe you did that because of this. And somehow that ran true for them in that moment.
So you had a natural intuition.
Yeah. So I guess that started me up. Yeah. A general curiosity really about what's going on for you, what's happening for you in this moment, why are you doing what you're doing. And psychotherapy taught me to listen more, which is something that we don't really do a lot of the time. So I learned to listen.
So instead of listening with the intent to reply,
you
really listen.
And it wasn't just listening to the verbal from the other person, but also listening to myself, listening to my gut feeling. What am I feeling in response to what this person is saying? Where am I feeling it? Is this really my stuff? Or is this what's going on for the other person? Because sometimes with experience you learn that sometimes what you're feeling is not so much your own experiences, but sometimes when people struggle to express or name their own process, you feel some of that stuff for them. And part of therapy is about bringing that to the room and bringing that into that other person's awareness about perhaps what you're going through.
So transference and counter-transference, or core transference.
That's it. That's the one. So that's what got me into psychotherapy. And then I think at a much deeper personal level for me, I think psychotherapy is very much a Western concept. And I never knew about psychotherapy which is Zimbabwe. And I think it's such a concept that I would like to introduce more to other ethnic non-minorities like me, about being able to articulate what you're going through, be outspoken about your experiences, and not to shy away from perhaps what's going on for you. And I think more so the fact that it's a contained environment, it's a safe environment, and you can totally be yourself, and that will be all right.
And find yourself.
And find yourself, yeah. And I think a lot, because I do think also that a lot of experiences we have sometimes are not really our experiences per se, but sometimes experiences that have been put upon us by, say, parents, for instance, teachers in school, other people, and I think it takes time to get to know ourselves, to find ourselves. And I think therapy allows you to do that and almost shut down all the noise around you, so you can focus on you.
I like that. So turn the volume down and you can really focus on yourself.
Yeah.
And I think about Jung, you know, who says we don't see the world as the world is, we see the world as we are. You know, learned behaviour and life scripts is what I'm hearing as I hear you speak, you know. All powerful stuff, you know, and very enabling, you know, and for us as people, you know, to have a self-awareness and self-knowledge, you know, so that's what I'm hearing.
And I think the other thing as well, I think from my own personal experience, is that I never had the words. I could feel a certain way, I could feel certain things, and know that, I feel a bit of discomfort, but I couldn't name it. I didn't have the words, I didn't have the language, I didn't have the vocabulary for it. So when you go and train as a psychotherapist and you meet a group of people, you learn a lot, you learn the words, you learn how to articulate certain things, which is so empowering.
So do you mean like emotional literacy and name it to tame it type thinking?
Yes, most definitely. I'll put it down to culture again. I come from a culture of very, keep it to yourself. No one really cares, you know, and
just get on with it.
Just get on with it. And particularly as a woman as well, you know, you're seen as a second-class citizen, so no one really has got the time to hear what you're about to say.
Powerful messages.
So training was a bit difficult as well to begin with. That said, because I came from that place that no one can, to train as a psychotherapist, you kind of need to learn to speak out and express yourself.
And allow people to care.
Yeah.
You know? Which is tough. I like to say it's the only thing worse than not getting what you want is getting what you want. Juxtaposition, you know. So here you are, getting what you want, being brave enough to to put yourself there. And that can be particularly painful to the past you that just had to get on with it and was missed and wasn't seen, I'd imagine as well.
That relearning was hard. It was really difficult at times. But also kind of feeling the pain and still going and going.
So with you being in private practice, who do you work with?
Who don't I work with? I work with everyone. I think.
Private referrals, people referring to you?
Yeah. So I've got my website, which is called Inner Talk with Nyasha. And then I'm also on the counselling directory. And I'm also on the UKCP website. And I'm also on LinkedIn. So my details are pretty much everywhere. So if someone is looking for a therapist, they'll either Google a therapist in such and such a place, in Leeds for instance, and then my details will come up, one or the other will come up anyway. And basically, it can be anybody. It can range from a teenager having relationship difficulties, perhaps with their parents, struggling to have a conversation with their parents, or just going through teenage life, really, bullying sometimes at school, to perhaps a young woman who's really struggling with her relationships, perhaps going through the whole process of kind of dating really abusive guys, for instance. And someone perhaps trying to really work out, what's that about? What is it about me that is attracted to this sort of guy? To people perhaps that perhaps just feel a bit depressed, who have got anxiety problems. And also, I also work with people just want to just self-develop, just get to know themselves, get to understand who they are, because that's so empowering. Because if you know who you are, then you kind of put yourself in good stead, in terms of the people you relate to, in terms of the people you attract as a person as well. I also work with people with mental health diagnosis, you know, people with personality disorders, schizophrenics, people with anxiety problems, or people just, or even sometimes with men that are struggling in their relationships and perhaps they know that they're abusive and they kind of just can't work out what that's about. Why do I do what I do? I really love this woman, but I beat her up and I don't understand it. So a lot of the people that I work with have got a willingness to want to know a bit more about themselves. They want someone to walk with them. They want someone to help them figure out certain things. They want someone that can listen to them. They want someone that can just help, give them a safe space. Because a lot happens in this world nowadays. There's a lot going on. A lot of people are parents and people are juggling loads of jobs. So no one really gets that quiet time. And what therapy allows you to do is get that hour, 50 minutes a week, where you can just focus on you, where you can replenish, where you can think things through. So yeah, so it's a range of people that I work with. I think a common myth that a lot of people say, they think that you have to have some sort of mental illness in order to go into personal therapy. You look at a lot of these celebrities, for instance, a lot of them, especially in America, it's huge in America, everyone's got a therapist. And it's what keeps you on track. It's a bit like working out. You don't only work out because you're fat and you want to lose weight, but it's quite healthy. It's good for your fitness, it's good for your health. And therapy is a bit like working the internal stuff, your emotions, going through, working out who am I, what am I doing, what I'm doing, and where do I want to go from here. So it also allows you to think about the next step forwards, and also it helps you to reaffirm certain things as well. So yeah, in summary, I guess.
Yeah, so it sounds like, as we've been discussing, with your cultural background, you know, from 0 to 18 in Zimbabwe, you know, and then coming over to the UK and in London, etc., etc. I imagine that you bring, you know, the field of your life has been vast, you know, so you've met and worked with and had experience of people from all walks of life, or many walks of life, you know, which I imagine will benefit you and your clients in the way that you work as well. So you're less, you know, less likely to judge as easily, even though we're trained not to, as therapists, you know, and have preconceived ideas. I like your curiosity, you know, that's what I hear. I hear passion and curiosity for life and for therapy. And I also like how you mentioned the American model, you know, how, and you're correct, you know, I've witnessed and experienced a lot of that. Therapy is a lot less shame-based and a lot less shameful in America. You know, they recognise that if we work on ourselves, the whole organism, we're going to make better choices left, right, centre in life. You know, so I like that you're experiencing that, and that you can, you know, be accessible to people who want to improve all of them, you know, on themselves, and are curious, you know, and who are motivated to change.
Yeah. Yeah, no, yeah, I guess my hope is to see more people engage in therapy and at least have a go,
Mm.
you know. I always say just do it, even just dedicate a month, for instance, a month to just focus on you because you're worth it, you know, you're important enough, and yeah, just give it a month. I always say just give it a month. All my friends will tell you, like, just have a go. You know what, if you don't like it after a month or so, then that's fine. But at least try and engage in the process and see what your experience is, and how different it is from probably what your preconceptions are of what the process is going to be like. And the key thing is to have a good therapist. Yeah, I would definitely shop around first, meet a couple of people, and try and be in tune with what you're feeling inside when you meet people. How do they make you feel? Yeah, and believe that, tap into that, and use that as a way of making a decision as to whether that's the right therapist for you. You know.
Instead of you should be, or
Yes.
being confluent with, you know,
Yeah.
the environment.
Yeah.
What I'm
Yeah.
hearing is really check out what works for you.
Yeah. And don't judge a book by its cover.
Mm.
That's a huge one. That's a huge one. Just because someone looks a certain way or has got a certain accent, or yeah, you do not know what that person brings to the table. Yeah, and I've been proven wrong a couple of times. So yeah, I would say just be open to the process and tap into what you're feeling. Yeah, and yeah, and allow the process to